Tonight, some Indiana couples are turning to a cold medicine in hopes of getting pregnant. All of this coming after some social media videos boasted of success. Allison Gormley tells us what's the deal.
Trying to get pregnant can be an emotional journey.
We're built to have babies, you know, and not being able to do that is tough.
3 years ago, Caitlin Buntain said she suffered an ectopic pregnancy, rupturing one of her tubes.
So ever since then, I've just not been able to get pregnant. It's been a tough journey.
Then a social media video popped up, piquing her interest.
It just came up, Mucinex to conceive, and I was like, no way. There's no way.
But she made her way to the cold and flu aisle anyway, grabbing some Mucinex and taking it daily the week of ovulation.
Well, if worse comes to worse, it just doesn't work. And it worked.
An emotional journey turning into a joy.
I don't know if that's God's work. I don't know if Mucinex did it for me, but it worked the same month.
Ashley Goldstein said she too got pregnant after taking Mucinex.
I've been diagnosed with infertility, many medical issues. So for me to have tried Mucinex one time for a cold and then to have gotten pregnant right afterwards, like I 100% believe it.
Goldstein said since then, she's recommended the cold medicine to others.
And so now I know 3 people that are pregnant from Mucinex.
The drug's active ingredient, guaifenesin, is intended to thin out chest mucus during a cold. The theory is that the drug could also thin out cervical mucus, allowing for easier fertilization. But is it proven?
The evidence is very poor. There are not good trials really recommending Mucinex.
Dr. Lora Shahine is a reproductive endocrinologist who said the only study she could find is from 1982. 40 women took 200 milligrams of guaifenesin orally 3 times daily, beginning on the 5th day of their cycle.
And 40% of the couples conceived within the following 3 months of taking Mucinex. So it's a very small study, was not well designed. It's using a test that we don't use anymore.
When it comes down to it, Dr. Shahine said pros include that it might help, though not proven, it's low cost, and that there are few side effects.
Some people will have nausea, some people will have headaches, but it's pretty rare. And I think a con is I just don't want anyone to delay getting testing. You know, Mucinex is not going to help blocked fallopian tubes or a really poor sperm count.
So while taking Mucinex for pregnancy is just a story, it's a story some moms are sticking to. Now keep in mind, while some of these people think that Mucinex worked for them, others say no luck.
So what do the makers of Mucinex say about all this?
They said that they're aware of all of the talk that's going on social media right now, and that Mucinex should still only be taken as intended, which is for cold and flu.
And you've got the entire statement on our website.
Yes, that'll be under What's the Deal at WTHR.com.
All right, Allison, thanks so much.